Hey everyone, welcome back to the channel. Today we're diving into the latest on the NB.1.81 Covid-19 variant. What it is, its symptoms, how it spreads, and what you can do to stay safe. If you want to stay informed about this evolving situation, stick around and don't forget to hit that subscribe button and the bell icon for more updates. Let's get started. So, what is NB.1.81? It's a new subvariant of the Omicron family, first spotted in late 2024 through global virus tracking. This variant has some unique genetic changes, especially in the spike protein, which is how the virus gets into our cells. These mutations might make it spread faster or dodge some immune defenses, but scientists are still figuring out the full picture. What we do know is that it's popping up worldwide, so it's worth paying attention to. Let's talk symptoms. If you've had COVID before or followed its variants, NB.1.81 symptoms might sound familiar, but there are some quirks. Most people report fever or chills, often with body aches that hit hard. A dry cough is super common, though some folks get a productive cough with mucus. Fatigue is a big one. People say it can leave you feeling wiped out for days. You might also notice a sore throat, sometimes one of the first signs, or headaches that range from mild to migraine level. Runny nose or congestion is more prominent with this variant, almost like a bad cold. Shortness of breath can happen, especially if you're unvaccinated or have health issues. Loss of taste or smell is less common now but still shows up for some. And don't be surprised if you get nausea, diarrhea, or stomach issues, especially if you're younger. Here's the deal. Vaccinated folks tend to have milder symptoms. But if you're unvaccinated or immunocompromised, NB.1.81 can still pack a punch. Oh, and some people might not even have symptoms but can still spread it, so that's something to keep in mind. Now, how does this thing spread? NB.1.81 is highly transmissible, potentially more than other Omicron variants. It moves through respiratory droplets, aerosols, or even touching contaminated surfaces. Think crowded indoor spots like offices, schools, or buses. These are prime places for it to spread. Early data suggests it has a high reproductive number, meaning one person can infect a bunch of others. That's why it's spreading so fast. What about vaccines? Good news. Current vaccines, especially the Omicron updated ones, still do a solid job at preventing severe cases. You might still catch it, but the odds of landing in the hospital drop big time if you're vaccinated and boosted. Speaking of boosters, if you haven't gotten one recently, now's a great time to check with your doctor. Antiviral treatments like Paxlovid or Remdesivir are still effective if you start them early. But some older treatments, like certain monoclonal antibodies, might not work as well against NB.1.81 because of its mutations. So, how can you protect yourself? First, get vaccinated and stay up to date with boosters. It's your best defense. Wear a high-quality mask, like an N95, in crowded or stuffy indoor spaces. Keep washing your hands, use sanitizer, and try not to touch your face. Open windows or use air purifiers to keep air moving indoors. If you feel sick or were exposed, test for COVID and isolate if you're positive. And stay in the loop. Check trusted sources like the CDC or WHO for the latest updates. Looking ahead, NB.1.81 is a reminder that COVID isn't done with us yet. It's not causing a huge spike in deaths compared to other Omicron variants, but its fast spread could stress hospitals if cases surge. Researchers are keeping a close eye on it, especially to see if it leads to long COVID or reinfections. For now, the focus is on boosting vaccination rates and sticking to precautions. That's the rundown on NB.1.81. Stay proactive, keep informed, and let's all do our part to stay safe. If you found this helpful, give it a thumbs up, share it with someone who needs to know, and drop a comment. Have you noticed this variant in your area? Let's talk about it. Thanks for watching, and I'll see you in the next one. Note, this is only education purpose. Consult a doctor if you have any symptoms.